Again, the same point that I made earlier, which is that while these procedures are useful for some patients, they're not needed for everybody. And there are other kinds of therapy that may be more appropriate in certain groups of patients. For instance, we know from the COURAGE trial, which is a very large multi-center trial that was sponsored by the NIH and the results of which were released just a couple of years ago, showed that patients who are on good medical therapy, who take their medications, who have their risk factors under control, meaning that their blood pressure is under control, their cholesterol is under control, their diabetes is well managed, those kinds of patients, even if they have coronary artery disease, even if they have blockages, they will still do just as good and will have just as good outcomes and will not have higher risk of heart attacks or higher risk of death when compared to others who received stents or other kinds of procedures. And what that study emphasized is the fact that medical therapy works and risk factor control and lifestyle modification works. So not every patient with stable condition or with stable coronary disease needs a coronary intervention. But even the same study, when further look deeper into the study, there were groups of patients who still had symptoms and still had angina despite good medical therapy. And those patients benefited from procedures. There were, generally speaking, a better or a higher chance of relief of symptoms when patients had procedures, although there was no reduction in the risk of heart attack or reduction in the risk of death. So what that says is that certain groups of patients who have stable disease will still benefit from intervention procedures and stent procedures, but that we have to be selective. We have to pick the patient who will benefit and don't put everybody in the cath lab just because they have coronary disease. A lot of patients have coronary disease but will do just fine by good medical therapy and by lifestyle modification.